So subtle tweaks are how we can improve life for our horses. And I think that's really what we all want to do. And just like magic, Kate has appeared. Kate, how are you?
I'm good, thank you. I'm just going to get this onto presenter view, and then hopefully you should be able to see
Amazing.
what I'm seeing.
Yeah, no, this is going to be really interesting because, as we said, we want to leave people with the ability to go and make improvements for the horses in their lives. And this is going to really help them. So thank you so much.
Thank you very much, Nicola, for inviting me to talk. Very much looking forward to the talk today. I could have been talking all day, to be honest, about this subject, so I've tried really hard to abbreviate it into a time appropriate slot, and I know everyone will be getting hungry and tummies will be rumbling, so we'll do our best to make sure we try to run on time for lunch. So Nicola has asked me to talk about sort of marginal gains in horses when we're thinking about an interesting subject and something that maybe covers lots of bases. We thought this was a good place to start. So we're going to be talking about the science of marginal gains and really how we can improve care and performance for leisure and sport horses by employing that technique. So what is a marginal gain? You know, I did a lot of research when I was doing this talk, and these little lycra clad bodies in the bottom corner of the slide here were what came up most frequently, really, because it was a term that was defined by Dave Brailsford, who became the new performance director of British Cycling in 2003. And to be honest, he completely transformed British cycling. You know, he essentially went from taking something from which was really not very successful, and sponsorship were pulling out of deals because they didn't want to be associated with a team that wasn't winning, to unparalleled success. So how did he do it? He really looked at the power of cumulative tiny improvements. So essentially, if you took everything it takes to ride a bike in a race, and you broke that down into tiny components and improved each of those by 1%, then you would see a huge cumulative improvement. And by employing the technique, he essentially got British cycling to win 60% of the medals that were on offer at the Beijing Olympics in 2008. Then in 2012, we went on and set 9 Olympic records, 7 world records. And the same year, we became the first British Tour de France winner. We actually went on and won it the next year, and we've won it several years afterwards. So I think we can all agree that he has made a huge difference to British cycling. And I think we've got a lot to learn from the technique that he employed and marginal gain in general. Sorry, just skipping ahead there. So this diagram here is published by James Clear, who does a really nice article on the power of tiny gains and marginal gain. And essentially, it's just explaining what do we mean by making tiny improvements and getting a big result. And this graph here, we can see that if we looked at being 1% better overall every day, so we're going to take British cycling as the example, but it can be for anything, then we multiply 1.01 by the power of 365, and we get a total improvement of 37.78%. If we were 1% worse every day, which I think would be quite easy to be honest, it's not a huge margin, then 0.99 times the power of 365 days, then we only make, you know, a really tiny improvement over a whole year. And I think, you know, not only do we not make an improvement, we actually make a decline. So just making really tiny improvements, even just 1%, can make a big difference if we continually practice it. So Dave Brailsford, he was a really interesting guy, and he basically looked at absolutely everything to do with British cycling and worked out, you know, some tiny areas of improvement. I mean, I'm talking thousands of areas of improvement, but some of the things that I thought were really quite clever that kind of came up when I was researching it is he painted the walls white of all the workshops so that all the teeny tiny specks of dust and dirt that could potentially ruin the components of the bikes or make them run in a way that, you know, was not optimal were identified and removed. He employed the top surgeons to teach the teams how to wash their hands appropriately to try and improve hygiene and reduce the chances of transmitting infectious disease. He took the athletes' own bedding with them everywhere they went, so they had the best quality sleep they could, looked at the mattresses they slept on, looked at the best massage gels, researched the most comfortable bike seats, looked at the best lycra. I mean, you name it, he looked at every single thing, and the result of which is obviously evident. So I think it's really interesting success story. He's got a very good autobiography if anyone's interested, and there's lots to say about him, but that's sort of where the science of marginal gains originated. So when Nicola asked me to think about marginal gain where it sort of applied to horses, quite literally I came up with hundreds and hundreds of possibilities where we could essentially improve things for horses. So most of us are not looking at competing at the next Olympics or Paralympics, but all of us, whether we're amateurs or professionals or somewhere in between, would like to really be the best we can possibly be, and we'd like our equines to be the same. So I've kind of highlighted in my talk, I've gone through sort of 19 areas which could be broken down into subsets of kind of areas where we can make, I think, actually really quite big improvements, potentially more than 1% improvement, but things that are easily accessible to us in everyday work. So the first thing I wanted to talk about is dentistry, because, you know, I wanted to start at the front of the horse, and I started with a sort of nose to tail approach, but it became a bit more tricky as I went on. So it sort of started with the nose, but it goes a little bit all over the place afterwards. So periapical infection and gingival pain is a really common cause of pain in horses, and it can induce avoidance behavior, which can mimic misbehavior. And misbehavior is often sort of misplaced in the sense that we think that these horses are being badly behaved, but actually what they're doing is they're displaying avoidance behavior, and dental pain is one of those things that really can cause that. As well as having sort of misbehavior, we can also see, you know, poor contact issues, crookedness. Sue highlighted sort of very pertinently working behind the vertical, and although that is often associated with training or poor training techniques, and also potentially weakness or hind limb lameness, actually dental pain has to be considered as a possibility for that, and jaw pain secondarily. So I think the importance of making sure the mouth is comfortable can't be underestimated. Ideally, you would like a 6-month checkup. So I think a lot of people slip into the habit of getting their horses checked every 12 months, and sometimes, you know, much less frequently than that. And I think one of the ways in which we can try and reduce the chances of dental pain becoming a major issue is accepting that if we notice the signs of dental pain, so head tilt, you know, head tossing, resistance when bitting up, shaking the head when they're eating, tilting the head to one side when they're eating, abnormal chewing, quidding, any of those things, then we need to highlight those and get the horse checked at that point in time. But as a minimum, we should be having them checked every 6 months by a suitably qualified person. And I think that's really important to say. It needs to be either a vet or an equine dental technician who is, you know, suitably qualified to carry out the checks and treatment that might be required. I think if anything is found, so for example, diastema or periapical infection, then I would strongly urge you to deal with it at the time rather than leaving it, as these things really are a welfare concern for the horse. So weight. So I'm going to bow down to Nikki's far superior talk on weight and obesity and the sort of the challenges that obesity kind of throws at us. But for me, I couldn't not include it, because I think it is such an important place where we can make way more than 1% difference to both ourselves and our horses. I think it's important to consider both the horse and the rider, and I think Sue talked really eloquently in her talk about you know, rider balance and where they're sitting in the saddle, and there's undoubtedly, unfortunately, of course you can be fit and a bit a bit fatter than we should be, and I think I definitely hopefully sit in that category, but there's no doubt about it, if you are carrying more weight than you need to, then it potentially can be improved. And I think for our horses specifically, it can definitely be improved. So, you know, Nikki talked really well about identifying like endocrine disease, and the fact that adipocytes can be pro-inflammatory. They can release pro-inflammatory hormones and markers, and that the benefits of a 10% reduction in body weight are, you know, are sort of highlighted hugely in humans. And obviously that's where, you know, Slimming World and Weight Watchers and all the other sort of diet and lifestyle kind of companies, where they're sort of aiming for really to try and improve health overall. It is a sensitive subject and it can be a difficult one to tackle, but I don't think that means we should avoid it. And actually, by building in body condition scoring and regular body weight sort of calculations into our routine. So our practice offers a worming program, and as part of that worming program, we weigh the horses and body condition score them twice a year. And it's a way of kind of getting in there and taking that information, even in people who don't feel their horses are overweight. So it can be really, really helpful. But I think the reason to really tackle it is because it is a real welfare concern. Not only, you know, we've seen the study that's associated with behavioural abnormalities and poor performance, but also improving blood pressure, improving blood sugar regulation by improving insulin sensitivity, improving heart health. You know, looking at left ventricular wall thickness, the study in those Shetlands, you know, that's really quite terrifying, to be honest, what damage we can do to our horses, asking them to, you know, to eat too many calories, really. And it is under our control ultimately, because we're the people who put them in the field, we're the people who give them the hay, we're the people who give them the concentrate feed. And I think these were Shetlands that were had really very little athletic demand. You know, we're talking about horses that now are going to have athletic demand, and you can't underestimate the effect that you know, potentially impeding their heart health could have on them, and certainly have on their performance and their overall well-being. It also decreases pressure on joints and feet. And I know that a friend of mine is an orthopedic surgeon, and he deals with knee cases, and I sort of talked to him about this talk, and we were having a bit of a chat about it, and he said that of all the things I'd listed, the biggest thing for him would be weight. His number one piece of advice or treatment modality for people with knee pain prior to surgery is weight loss. And he estimated that, you know, a good proportion of those people who come to see him and see a nutritionist and discuss weight loss and successfully lose weight often go on to not require surgery. So I think it is really, really important. And Nikki did a fabulous job. It was such an interesting talk, and I learned a huge amount too. So hopefully you guys did as well. But definitely an area to think about, where you can make quite an easy marginal gain for your horses and potentially for you as well. So another area that I personally think is hugely important is foot balance and farriery. And I'm quite passionate about this, because I think this is something that is important to all horses, whether they are, you know, pootling around in the field, whether they're happy hackers, or whether they're competing at a really high level. It's a phrase that is as old as time, no foot, no horse, but essentially it is, you know, it is true. And I think that we need to choose our farriers wisely. So we need to choose somebody who's invested in doing the best for our horses, somebody who's happy to work as part of a team. So people's ability to play with other people nicely varies amongst the industry. And I think choosing someone who's happy to work with you, work with your horse, and work with your veterinary surgeon is really important. And to someone who thrives off that sort of, you know, team effort as well. I think consider the benefits of radiography. So I have continually over my career been surprised by what x-rays show me. So sometimes I look at horses and I think, I'm pretty sure what something's going to look like on the inside, and I still a few times a year will be surprised by what we find. And I think the benefits of radiography is that it tells you what the bony components of the limb are doing on the inside. It helps you work out hoof past an angle, helps you determine truly where center of balance, center of the coffin joint, etc. should be. And although there are some really good techniques that are used for measuring feet on the outside, and I think lots of farriers now use those in order to determine where the best place for the shoe placement, etc. should be, then I think radiographs still can be very, very useful. And a lot of our performance horses will have their feet radiographed once a year as a routine to make sure that we're kind of on track. But not only looking at shoes, but just generally looking at hoof health. So how are we keeping our horses? Are they stood out in wet, muddy fields, which will impact their hoof quality? Are they getting an opportunity to come in and stand on a dry surface? Are we cleaning their feet? Are there cracks that we need to be dealing with? Seedy toe. As Nikki said, sort of subclinical laminitis is a huge issue. Identifying that, looking at improving that rather than letting it become, clinically apparent. Thinking about what we do with our horses in the winter, because getting continually wet and dry is not necessarily particularly good for hoof health. So are we moisturizing those hooves? There's lots and lots of products available on the market. Are we providing adequate nutrition? As Nikki said, a lot of our horses don't require concentrate feeds at all, even those working at really quite a high level. However, what they do need is trace elements, vitamins and minerals required for healthy, for healthy horn growth and for healthy keratin. And I think that looking at that, and potentially even in those horses that are good doers, really don't require any additional nutrition, is it maybe that we have to provide them the building blocks for good hoof health, and that can be provided with a variety of different hoof supplements. But yeah, really, really worth looking at, because I think if we optimize hoof health, we optimize foot balance, we optimize shoeing intervals as well. Don't leave your horses too long between shoeing intervals. You can have a great farrier, but if you're going 9, 10, 12 weeks in between times, or you only call in when one falls off, then it's probably going to be a bit pointless. And I suspect that your very good farrier will eventually get quite bored with that as well. So making sure you're regularly seeing the farrier, thinking about what's on the foot. Have we got pads? Have we got road nails to reduce slipping on the road? There's so many things to do with the foot and farriery that can make such a big difference to the way our horses work day in, day out. They use their feet continually. So it really is an area that we should be focusing on, quite heavily. Reducing injury rate, reducing injury recurrence, and also improving the management of orthopedic conditions. There are, tons and tons of horses, the vast majority of my caseload, who function with various orthopedic impediments. And I think that making sure that you trim and shoe that horse according to those requirements really can't be underestimated. So I think this is an area where we can definitely see more than a marginal gain. And even in horses that are really well managed, it may be that there are improvements that can be made as well. So I put this early up in my list here because I think mental health, particularly over the last 2 years, I think has become even more, it's not more important than it ever was, because ultimately it's always been really important, but everybody's become much more aware of it, I think, and it's become much more mainstream. Sportsmen and sports people, and particularly horsey people, I don't think we're very good at accepting that, we're less than perfect. We like to be strong and tough and, nothing bothers us. But the reality is we are just human beings, and life's tough sometimes, and particularly when you're competing, if you're competing professionally, if you're doing it as a job, if it has a huge financial impact, then, it does really come into things. And I think we're always looking at making sure that our horses are as happy as possible. And I think most of us, go without so that our horses get everything that they could possibly want, but we don't always focus on ourselves. So I really wanted to put this kind of fairly high up the list, because I think happy athletes perform better. That's the reality. And then whether that's the horse or the rider. And the science of sports psychology is really sort of a fairly new discipline, but I think it's become incorporated in a lot of the top level athletes and performance directors of all the disciplines for equestrianism. They will be employing sports psychologists to work alongside our equestrians to make sure that they're in the best possible headspace for competition and that they're able to perform to the best of their ability. They also have a huge amount of social media training and all of these different things that come with it, but it's still relevant to the average Joe, people like you and I, because I don't know about you, how many people get nervous? Okay, how many people feel nervous when they are competing or nervous about going to a new venue? Some people might feel nervous about hacking, might feel nervous about schooling, nervous about having a lesson. Doesn't mean you don't enjoy those things, but it still can bring about a layer of anxiety. Worry about what people are going to think about you, think about how you've performed. Are they going to judge you? Are they going to judge your horse? You might be working professionally and trying to sell this horse and you're worried about how it's going to perform out in the open world. You don't want that to be a negative thing. There's so many things that can lead to anxiety, even things on the outside. Are you leaving your children behind to go and exercise your horse? Do you feel guilty that you're taking time away from being a mum or a dad, an auntie? Are you juggling work? There's so many things that contribute towards anxiety in relation to riding and competing. And I think some of my sort of top tips, I'm not a sports psychologist by any means, but some that I do spend a lot of my job, my day-to-day job, counselling my clients and my owners, and listening to their worries and listening to their woes and really trying to help them. And I think some of the things that came about from researching this subject are that you need to choose the right support crew around you. There's no point in having stressy individuals who cultivate negative beliefs. You want somebody who is positive and supportive and helpful and is someone that you want around you in your toughest times. Choose the right vet, choose the right trainer, choose somebody who enables you, supports you. Don't choose someone who belittles you or makes you feel less than worthy. Fear is a physiological response, and actually it's quite healthy because in theory it stops us from getting injured or doing things that potentially could be harmful. But it's important to tackle fear and confidence issues early because fear can become prohibitive, and it's trying to make sure it doesn't get to the point where it's crippling and it stops you from doing something that actually you do really enjoy or you want to do. Think about asking for help. Don't suffer alone. Don't worry, you are not the only person who feels anxious about doing something that somebody else does without even thinking about it. I've become much windier about jumping since I've become a mum. I used to think nothing of it. I'd happily pop a log on a hack and all those different things. And now, instead of, I overthink it. I think, oh, but what if, or is the ground okay? Or God, it's not worth it. And I think it's very easy once you've got additional responsibilities to overthink these things, particularly if you've had a bad response, a bad experience in the past. I've had several fairly major accidents horse-wise, and when those things have happened in the past, it's very easy to let them become bigger than they should be in your mind and impact how you ride going forwards. And I think developing rituals and strategies to cope can be really helpful. You can do those on your own. There's lots of resources online, but also your trainers potentially will be able to help you with those. Nicola, as I said, NKC Equestrian runs lots of workshops and things, and a lot of that is about positive mindset and helping yourself be the best you can be, surrounding yourself with the right people. It kind of carries through all walks of life really. And it gets said so often, but I think just be kind, okay? Be kind to yourself, be kind to others. Make sure you are, if you haven't got anything nice to say, don't say it, and don't surround yourself by people who do. So this is another area that is a particular interest to me. So I talked about this last year at the 2020 Healthy Horse Conference, and it is the importance of warming up and cooling down. So I think this is an area which is often sort of missed. I think everyone talks about warm up and less so about cooling down. But for me, my top tips would be, make sure it's on your agenda. Okay, don't just think about the exercise session itself, don't think about the lesson, don't think about the competition or the dressage test, think about getting there and coming back from there in the first place. So stick to a routine. So there's lots and lots of evidence to show that sticking to a routine in your warm-up can really help with anxiety, actually. So linking back to mental health before, can improve performance, and also can make sure that you don't sort of get lost and end up going down a rabbit hole when you're under the time pressures or the pressure of competition. So don't skip it. That's the most important thing. If you are short on time, then your warm up and your cool down can be your exercise session for that day. Even if you are competing, you really should incorporate some level of warm up. We've all arrived late at competitions, or things have happened that have meant things have not gone well, but don't panic. Get somebody who's hopefully with you to go and talk to the organisers. They're normally extremely understanding, and they're all horse people too, and they're not going to want you to go in and rush something so that it doesn't go as well as you possibly can, because you might as well not bother doing it at all, to be honest. Warming up and cooling down effectively reduces injury and it promotes recovery. It also really helps in horses that have other sort of orthopedic conditions. It can really help to get the best out of them. It can help you feel how they are as well. It's a kind of set routine that you do. So if you know that you always go in, you walk on a long rein for X amount of time, then you walk, you change the rein, you trot, you canter, then you do some lateral movements. It'll enable you to feel how the horse is feeling. It also really helps the horse. So horses are creatures of routine. They are really driven by the routine of life. They know people's cars when they drive in, whoever gives them breakfast, they can hear it coming down the lane. They know if you're 10 minutes late for doing so. And I think that horses get anxious as well, and often to prepare them for what you're about to do, which might be out of their comfort zone. They may never have been to this arena before. They may have never been to this, this course before, on this hack before. Actually, if you use the same warm-up routine, then you're just giving them that metaphorical hug and pat to say, you're okay, you can do this. This is something that's familiar to you. And I think it's important to both horse and rider to get in the zone. Cooling down is often missed. I see people kind of thinking that once the horse's breathing rate comes down to normal, that's effective cool down. And I think I would just say, cooling down can be physical cooling down with water, with ice, with convection by walking horses round. But it's basically getting them from a point of, maximal exercise to a point of rest in a gradual fashion, so that muscle enzymes, can settle down, heart rate can settle down, blood pressure can settle down, breathing rate can settle down, and we reduce the chances of stiffness and all of those things kind of happening. So really, really important. And there's a tendency to forget it when there's inclement weather or when you're under time pressure, but I would urge you really not to, for good reason. So gastric ulceration is something that I think almost everybody is aware of now. It is hugely, hugely common, very, very, very common in amongst all different groups of horses. I see it particularly commonly in my poor performance cases, because I think that almost all horses who have orthopedic disease also have equine gastric ulceration, as repetitive orthopedic pain can be a trigger for it. And I think one of the things that I would say at the very beginning is, if your horse is treated for gastric ulcers, and despite improving management, reducing stress triggers and appropriately dealing with it, you are still seeing recurrence, then really you need to go back to square one and have a look at this horse orthopedically. So I've seen several horses as second opinions over the years who have been on treatment for gastric ulcers for months with very little improvement, and the vets dealing with them have done really well. They've got an absolutely appropriate management system and treatment system, and the owners are also being very diligent, but the ulcers either keep on recurring as soon as medication is withdrawn or are not improving, and most of those cases have got underlying orthopedic disease. Some of those you can only see by using some of the ethogram techniques that Sue talked about earlier. So it's not necessarily overt lameness, but tail swishing when the leg's applied, a fixed intense stare, open mouth, all of those things you might be seeing under saddle, and they should be pushing you towards thinking about this horse being uncomfortable somewhere. So gastric ulceration is hugely important, and I think it's a big welfare issue and should definitely be tackled, but it's not always quite as simple as just the stomach. So gastroscopy is the gold standard for identifying gastric ulceration, and we run gastroscopy clinics regularly, and it's amazing. There are often horses who are absolutely certain are going to have gastric ulcers and they don't have them, and then there are some that you are not convinced they have gastric ulcers as their main issue. So they might be having a problem with medium trot or something that's really quite minor that you think actually is not going to be related. You identify some ulceration, treat the ulceration, and the horse's clinical signs improve. So I think we do treatment trials, but I would urge you against it, because there's definitely horses that can receive really quite expensive treatment that don't need it, and you might have other horses who you don't think need treatment who actually do. Management's really essential to eliminate triggers. So the symptoms of gastric ulceration are really variable, and the triggers for gastric ulceration are also variable as well. But strictly speaking, some of the things you can do are avoiding stress triggers, so prolonged periods without feed and forage, reducing social isolation. So actually one of the biggest one of the high risk areas of obesity is pulling these horses off a pasture, pulling them away from their companions, and actually those horses are really likely to get gastric ulceration because we're reducing their forage intake, reducing their overall consumption of food, and also we're taking them away from their friends, and potentially reducing or eliminating turnout entirely. So I think some of Nikki's suggestions about using straw, which obviously is a very low calorie dense forage source, etc., can be really useful, but obviously not in entirety and with the advice of your vet. But feeding a small chaff-based meal before riding, making sure horses have access to water, adding oil into feed. There's lots and lots of things we can do that can potentially, they won't treat ulcers if you've got them. If you've got gastric ulcers, then you need medication in order for those ulcers to go away, because you need to create an environment where those ulcers can heal rather than just bathing in acid. But there are lots of things you can do to help manage gastric ulceration and reduce the chances of your horse becoming ulcerated in the first place. So I think again, an area where gains can definitely be made for all horses, not just performance horses. Vet check. So again, this is something that I'm quite passionate about. I'm lucky enough to be the vet on the team of lots of horses, all performing at different levels, and I encourage my clients to think about regular assessment of their horse. I think it's really important to collect baseline data about how the horse goes generally, because even when it's performing at its absolute best, it may still have some asymmetries, it may still have some orthopedic issues that it's managing, dealing with. And actually knowing what's normal for that horse can really help you identify throughout the season or throughout the years when things start to deteriorate. So we might know a horse has hock OA, for example, osteoarthritis of the hock joints, but actually it's coping perfectly well. If we look at this horse every 6 months, we might be able to ascertain when it's appropriate to consider medication, when it's appropriate to consider weight management, etc., when there might be other things going on, might need to consider non-steroidal, etc., etc. And I think that any horse who's starting work, any new horse, any horse in work generally really would benefit from regular assessment. But I think choose your vet wisely. You want someone who you can develop a relationship with, somebody who's got an interest in poor performance and orthopedics would be an advantage. And I think someone who you can talk to, someone who you can have that chat with and say, do you know what, I just don't feel like they're going the way they were. And you can explain what that is, and that person can sort of, be on your team. I think tackling issues early to reduce their impact, because as, again, going back to Sue's original talk, there's lots of horses who are performing really well, performing better than the population of horses overall, but they could be better. And I think all horses could be better. Sometimes people are a little bit scared of getting the vet involved with regards to orthopedic things, because I think once the vet's involved, that's it. You know, the horse is written off, they're going to be written off for navicular disease or written off for osteoarthritis. And actually, getting the vet involved doesn't change the pathology. The pathology's there regardless of whether the vet's seen the horse or not seen the horse, but it could be that we could make quite a big difference to the horse by treating it appropriately. So, you know, don't be scared to, you know, to kind of get us involved, even when the horse is going well. In fact, actually, I like to see the horses when they're going well so that I can tell when they're not, essentially. Respiratory health. So we can see this little Connemara with his head shoved right into a hay bale now. And I think respiratory health is something that's really worth talking about, particularly at this time of year. 88% of stabled horses have some level of airway inflammation, according to, you know, some studies. And I think that all horses, particularly stabled horses, benefit from us optimizing respiratory health and thinking about how we can do that. You know, if the horse can breathe well, then it will perform better. Even with low grade airway inflammation can reduce performance. So I think really important area of, you know, kind of improvement we can look at. We need to think about ventilation, the forage quality, reducing respirable dust, mold and fungi and bacteria. And we can do that by, you know, either choosing the quality of the forage we actually feed in the first place, but also considering steaming and soaking as well, because, you know, getting rid of those airway irritants is definitely important. And I think other airway irritants and things that we can do to sort of improve, even in horses that don't appear to have clinical signs associated with airway disease, are, you know, open windows, don't store hay and straw and muck heaps right by stables. You know, ideally those horses do not want to be breathing that in 24/7. Identify equine asthma sufferers, because they really do need to be managed particularly carefully. And I think that identifying those animals, treating them with medication and also management is key. And I think medication is a tiny bit of management of airway disease. You know, environmental management is far more important, and there's things that we can all do. So, you know, look at the quality of your bedding, reducing and removing ammonia. Okay, one of the biggest airway irritants. So making sure that, you know, whatever method you employ and whatever bedding you use, that it doesn't smell of ammonia when you go into your horse's stable. If it does, we need to look at drainage, you know, changing the bedding, changing the way we're mucking the horse out. Don't muck the horse out whilst they're in there. You know, if you ever have a sunny day or a stream of light sort of flowing into a stable, when you're chucking whatever bedding you use, you chuck it up in the air and you can see the dust in the light there. And if a horse is stood in the stable at the same time, they'll be breathing it in. And we've all experienced the black bogey phenomenon if we've ever been into London and been on the tube, or if you spend a day mucking out horses, and it's amazing, you know, what your nose will catch. So just think about, you know, that's a visual representation of what might be going down into the horse's airways. So really important to avoid sweeping, mucking out, you know, doing those sorts of things whilst our horses, you know, are there, if you can possibly help it. So TAC is a bit of a crossover again with, you know, with Sue's talk earlier, but I think it's really important to have as an area where we can easily make improvements. This image here shows saddle slip to the left hand side. This horse is cantering and it's slipping to one side, as is the rider. And I think, you know, things like appropriate bridle fit, appropriate bitting and appropriate saddle fit are hugely important. I think it's easy to think that something fits just because you've used it for a long time and there's been no problems. And actually that isn't necessarily the case. I think we're all quite guilty of thinking, you know, well, I've used this saddle for ages and I've never had any problem, and the physio never says that the horse has got a sore back, or that doesn't actually mean that the fit is appropriate. It still could be potentially improved. And I think don't just think because you've always done it that it's okay. I think getting your saddle checked, templated and assessed by a suitably qualified fitter every 4 to 6 months is really important. I think even the best saddles can require reflocking, can require adjusting. Hopefully, if your horses are working well and developing new muscle and top line, then that saddle won't fit perfectly forever. You know, if your horse is improving, then actually theoretically you should need to make some adjustments, you should need to change things. I think also identifying saddle slip, there's lots of studies, of course, which Sue has been involved in a lot of them, looking at the association of saddle slip with hind limb lameness. And I think for me, when I see saddle slip, if I'm watching a horse under saddle, I'm straight away I'm thinking about those things. And I would encourage any body workers, yard managers, all of those things to be thinking about that as well. And if you are seeing saddle slip, if you're feeling it as a rider, then it may well be that it's due to hind limb lameness, and it's worth investigating those things early on before they become problematic. There are other reasons for saddle slip, which we won't go into in detail here, but I think definitely ruling out lameness has got to be sort of top of your priority list. Local environment. So this sort of seems like an odd thing to have as your kind of marginal gain, but actually if you think about how long these horses spend in their local environment, so thinking about their stables, it's actually the place where you can make a big difference to a horse. So is the horse happy where it's stabled? I think horses that are anxious and stressed and worried about where their friends are will not be eating as much, are more prone to gastric ulceration, and also just generally less happy individuals. So are they happy? Can they see their friends? Do they like to see their friends? There's some horses can't stand other horses. So actually, if they're in a barn where there's nose-to-nose contact with other horses and that stresses them out, then think about reducing that for that horse. Have they got ventilation? Can they see out? Is there adequate light? What's the bedding like? Is the stable size appropriate? Have you got any enrichment in the stable? Do you hang something in the middle, to keep the horse busy? Do you think about trickle nets to make sure that the horse has got forage at all times but isn't developing obesity issues? The fresh water, it's a really small thing, but in the winter often that really slips down the list. The amount of stables I go into where the horse's water has not been refreshed, and actually the horse is less likely to drink it in most cases if it's not refreshed. Some of them love old water, and if that's your horse, then great, let them drink that. But most horses like fresh water, same as us. Would you like to drink a glass of water that's been sat on the side, is lukewarm and potentially been there for 2 days, or do you want one fresh out the tap? And I know what most of us would say. And particularly in the winter when turnout reduces, water intake is hugely important for reducing the chances of impaction colic. And impaction colic can obviously be a big vet's bill, be a big welfare issue, and also can potentially give you days out of training and days off work. So definitely worth looking at. So don't underestimate the local environment. Is it safe as well? Are there nails hanging out anywhere? Are there splinters? What's the footing like? Is the horse confident enough to lie down, get up safely? All of these things, really, really important. Is it dusty? Are you removing the cobwebs? Are you removing the dust? Has it got sufficient ventilation? All those things are really, really important, and areas that we can really improve for our horses. Turnout. So this person on the right here reminds me of my horse. This is what my horse likes to do in the field, and it's slightly nerve-wracking whenever you watch my horse in the field. But I think turnout cannot be underestimated, its importance. Horses ultimately were designed to graze for 18 hours a day and to wander continually. But we've changed things quite a lot, and obviously we do have some horses that go out 24/7. Unfortunately, in the southeast of England, we're a bit short on land down here, so turnout 24/7 is actually a rarity where I am. But in other areas of the country and other areas of the world, then it will obviously be more common. But I think it's really balancing out mental health of the horse and the caution of injury risk. Okay, so great to see horses expressing themselves and pinging about and having a buck and a roll and etc. But actually it does increase the injury risk. So it is balancing those two things, thinking about winter turn out options. And we're on clay where I am, so actually turn out at the moment is fine, but as soon as it gets very wet, then the fields are pretty much off limits. So we have lots of bark chippings pens where horses can still go out, can still wander around, can still roll, and they can still sniff their friends, etc., but they don't have the risk of injury that's associated with going out on deep wet clay, essentially. So think about the footing, think about making sure the fencing is safe and robust, thinking about companions carefully. I think, companions are very important for horses, but ones that are a bit naughty and lead your horse astray, probably best avoided. And we've all got those companions that, are maybe not the best of buddies for our horses if they're encouraging them to behave badly. So I think particularly for competition horses where, it's really imperative that they're not injuring themselves and they might be a little more highly strung, then, choosing an appropriate buddy for them that doesn't encourage bad behavior is a good idea. So that sort of leads a bit onto cross training, sort of talking about different kind of surfaces and thinking about how you work. And I think cross training is essentially something, it's not doing the same thing over and over again. It's making sure that your horses are working on different surfaces, doing different things to make sure that we're working different muscles differently, and we're avoiding repetitive strain injury by essentially repeating the same movements over and over and over again. It reduces injury rates by reducing repetition and reducing the chances of us using the body in the same way over and over again. It improves fitness, particularly cardiovascular fitness, if we're incorporating hills and different surfaces. Pay attention to the surface quality. So not all schools are the same. You can get very, very good quality surfaces, and you can get very poor ones. And actually the most modern of surfaces aren't necessarily the best surfaces either. So really pay attention to what it is you're training for, how long you're in there for. Are you maintaining the surface well? So there's a big difference. You can have an amazing arena, has the best surface, but if you don't harrow it very often and you don't mix up where these horses go, then it will still be a bad surface. And I think that's something that we see at competition venues, where you assume that these huge venues are going to have fantastic surfaces. Well, they do, but they need to maintain them appropriately in order for that surface to stay safe and to stay appropriate. Avoid overtraining. So I can certainly be guilty of, when things are going well, of losing track of time. And I think that can be important to set a timer and make sure that you're not overtraining, you're not spending too long doing something with your horse. Equally, when a horse finds something difficult, or if you're getting a lot of resistance, then there's a pressure to push and push and push until you get the result you want. And that might be appropriate in some cases, but just be cautious about it, be aware of it. You want to have some general fitness elements, but you also want to have some discipline specific elements as well. If your horse is going to be required to go around a cross country course for 5 minutes at a certain speed, needs to be doing some speed training, needs to be doing some stamina training. If your horse is an endurance horse, it needs to be, doesn't want to just go out at the weekends and go and do a 40k ride. It needs to be doing some shorter rides and some longer rides in between times. Don't lunge excessively. It is my biggest bugbear. I haven't got enough time, so I just thought I'd stick the horse on the lunge. Or my favorite, it's too hot to ride, so I'll stick my horse on the lunge. You think it's hot for you, and then you stick your horse on the lunge where it goes round and round in circles far more than it would do if it had you riding it. Really think about why you're lunging. Lunging can be great, can be really useful, but think about why you're doing it and don't use it excessively. It will often put a lot more strain on joints and on the bodies of the horses than just riding. And also some horses can be very badly behaved on the lunge, so it can increase the risk of injury. Stick to a plan for your best results. So, make a plan for the week and stick to it. If you think about, are you hacking once a week? Are you doing hill work once a week? Are you using pole work? Sue discussed the benefits of that in her talk, and I think, can be useful for all horses. Are you doing a mixture of straight line work, a mixture of suppling work, a mixture of strengthening work? Are you jumping appropriate number of times a week, not jumping 3 times? Are you doing it once? Are you only doing it competition? Have a real think about, how you're doing it. And we can answer any specific questions you have, but these are just some areas where you can potentially improve your general routine. Think about using your schooling elements whilst you're out hacking. You know, as Sue said, opening multiple gates, you know, practice that rein back as you're opening the gates. Think about turns on the forehand as you're, you know, turning around corners, practicing your lateral work. You know, might even be practicing your medium trot, depending on, you know, where you're going, medium canter, etc. So lots of things that you can practice when you're not in the arena. You might get a better result from the horse as well. Some horses can get quite sour in the arena, whereas when you're out hacking, they're more inclined to, you know, put a bit of effort in, and sometimes you can get a better result. So I couldn't really do a talk as a vet without talking about biosecurity, at least briefly. So I think, you know, ideally you want to avoid contracting disease, because it might seem like a funny way of discussing marginal gain, but as I talked to you about earlier, you know, Dave Brailsford hired the best surgeons for hand washing to teach hand washing techniques to reduce the chances of the common cold and other things spreading around the athletes, because they take you out of training, they take you out of work. For every day that a horse is pyrexic, has a temperature, they should have a week's rest. So, you know, 3 days of a temperature equals 3 weeks of rest, ideally, for recovery. Think about how much fitness they can lose in that time. Top line, you might miss the really important competition that you're aiming for, etc., and the impact on other horses. So you can vaccinate against equine influenza, tetanus, and EHV, and it's worth considering doing so if it's appropriate for your horses. I personally think flu and tetanus are essential for all horses. I think EHV is something that ideally we would encourage herd immunity on, because that's how EHV vaccination works. So if you are the only person vaccinating for EHV on your yard, there is probably little value in you doing so, other than the individual benefit to your horse. However, if you're on a yard where you can get a good take up of vaccination, then it's potentially really worthwhile doing so. Think about your own tools, your own water. One of the most horrifying things I ever saw was I was working as a vet on call at a local event of ours, and the water trough, basically, instead of using it to go and get buckets of water out, all of the competitors were essentially letting their horses go and shove their noses in there and make a sort of snot soup for all of them to ingest and stuff. And it was just amazing, because it was very tempting. You could see it was this big water button. Everyone thought, fantastic, let them have a drink, not thinking that another 100 horses had a drink from there beforehand. And I did think, God, I really hope nobody's a strangles carrier, because if they are, then we've just found a very effective way of disseminating strangles amongst the entire place. So the other thing to think about is, you know, do you have a plan? Does your yard have a plan? Are you on a yard where biosecurity is taken seriously? What do they do with new horses? New horses are the most, you know, the biggest infection risk. So dealing with them appropriately from point of view of quarantine, checking disease status, etc., is important. And if you are someone who's competing and going out to different venues frequently, then make sure you're monitoring your own horse's health, taking temperatures as a baseline, you know, identifying any disease that, you know, might be on show, and not traveling your horses and taking them places if they are, because you can you can make things worse and obviously pass things on to others as well. This lovely poo hoover hair being demonstrated by this lady, this girl here. But the reason why I talk about worming here is because I think people think marginal gain, like, really, is that really going to make a difference? But actually 80% of horses live in 80% of worms live in 20% of horses. And so there are some horses where, you know, where worms are a real issue, maybe not necessarily to the horse, but to those around it who don't have the same sort of tolerance for horses, but for worms at the same time. I think it's important to reduce resistance by employing a targeted approach to anthelmintic use, because if we reach a point where we don't have any more drugs, okay, there's no more drugs coming to market, there's no more groups of drugs coming. So what we have is what we have and what we will have going forward. So pasture management, identifying the horses that are the biggest problems and dealing with them appropriately is really important, because if we get widespread resistance, we will have very little that we can do about it. And there's no doubt about it, having a worm burden will reduce the absorption of food, can cause gut ache. You know, you think if a horse has got a worm burden, then they could well have gut inflammation. it can cause diarrhea. You know, there's lots of things that can potentially impact the horse adversely. And there's some horses that appear to be able to tolerate a very high worm burden without any clinical signs at all. But we can't ask them, we can't say, do you ever get bellyache? Because they can't tell us. But we do know that, you know, horses who have worm burdens or are inappropriately worm managed are more likely to colic, more likely to have weight loss, etc. So try to take that off the table by managing things appropriately. Something that sort of feeds back to mental health a little bit, but also links to orthopedic disease. And I think this is something that's often sort of forgotten a little bit when it comes to training towards something. We're often focused about the things we should be doing and not necessarily about the time off that we give ourselves. So this is important for the horse and the rider. It's important that we make sure that we're adequately rested, so we're getting enough sleep, particularly in the days running up to competition or training, etc., and making sure that the horse is getting adequate sleep. So this goes back to local environment. Have they got a suitable stable in which to sleep? Have they got a suitable field in which to sleep? Have they got orthopedic disease, which is potentially stopping them from lying down, you know, or making them uncomfortable? Are you giving yourself and the horse down days or easy days? There are some horses that really don't benefit from having complete days off. You know, they kind of become naughty or difficult, but actually most horses benefit from having easy days, and riders do too. So that you just say, do you know what, today I'm just going to do stretching work, or I'm just going to walk on a hack, etc. Making sure you build those things in, because if you're ever somebody who, I did the couch to 5K during lockdown, and actually it's amazing how you feel good, and then you realize you start to not feel as good if you keep on pushing yourself at the same level. Actually, your body does need time to recover. Your bones, your tendons, your ligaments, they need to adapt to the load and the stress that you're asking them to do, and they can't do that if they're being repetitively loaded. You need to do those things, and then you need to let the cells and the body recover in order to improve. And you need to go in that cycle as you're going up the training levels. You know, not giving yourself any time off, not giving the horse any time off is not necessarily of benefit. Either complete days off, or, as I say, easy days. Note to self, lunging is not an easy day. It's an easy day for you, but it's not an easy day for the horse. So I often hear that. It's like, oh, well, I've only lunged him today. Okay, but how long did you lunge him for? And what did you do whilst you were lunging? It's different if you're, you know, doing pole work or doing something that maybe encourages stretching or long lining, something that could be beneficial, but it isn't a day off for your horse if you're going round in circles. Be careful about the competition season. So I often encourage my show jumpers and my eventers to sit down and write down their competition dates and to work backwards for when they're going to do their training dates from there. Because if you're competing every weekend, every couple of weeks, then you need to make sure that you are not over jumping in between times. You're not overworking horses in between times. Are you giving them a day or two off after they've competed so that they can rest, recover, relax, mentally and physically? It's very easy, particularly for the show jumpers, because they have quite a short season for outdoor show jumping over here. And so, or if you go over to, you know, Portugal or somewhere like that where there's jumping every day, it's quite easy for those horses to overwork, which obviously increases the chance of injury, etc. And I've just put myopathy here because it didn't sort of really fit anywhere else, and I just wanted to highlight that I think PSSM and other myopathies should always be considered where you have horses that aren't able to perform in the way that you think they should be, or have you know, or struggle with stiffness, or appear to need days off, or aren't as good when they've had a few days off, etc. I think it's very overrepresented in cob breeds in particular. We see a huge amount of it, and it's definitely something to be considered at this point in time. And avoid repetitive training because it leads to fatigue. You know, again, if you work horses hard day in, day out, and you're practicing a lot, then those horses will get tired even if they don't have an orthopedic issue. So consider sort of managing things carefully. This sort of ties into kind of, you know, regular rest and recovery, and it's really having a regular assessment and treatment by a physio or body worker, bringing them in as part of the team. So you chose your farrier wisely, you've got a good relationship with your vet, and now you need to think about your, you know, your physio or your body worker. You know, get them to know what normal is for your horse, because we're all individuals and horses are as well, and they carry tension and you know, and stress in different ways, and they have areas of weakness and areas of strength. But knowing normal, identifying abnormal, and really focusing on core strength, stretching and suppleness in our horses, using stable exercises to stretch necks, backs, etc. You know, identifying, you know, are we developing top line normally? Do we have any areas where we feel like it could be better, and why? The underdevelopment of lumbar musculature that Sue talked about in the first talk, you know, really important to identify that, and then go back and look at your training methods, try to identify whether or not there's any orthopedic reason why that's happening. Early identification of back, neck and pelvic pain is crucial. It might be that it's primary, and it could be related to saddle fit, could be related to training method, etc., surface type, you know, and it might be that you need to go back to the drawing board and look at that. Or it can be that it's the first manifestation that a horse is starting to struggle with something else orthopedically, because they often will brace higher up as a compensation mechanism for a distal limb issue. And if these things are coming up time and time and time again, despite adequate training, despite rest days, etc., then you need to go back to the drawing board and make sure you're not missing something. I love this little picture, this little girl, not my picture, but post-match analysis. I think this is an area that is a potential benefit. It's a funny thing to put in a talk in some ways, but actually it is somewhere that you can really make an improvement day to day. I think looking honestly at your performance and at the performance of the horse is really critical. Be honest. Avoid excuses. We all make excuses. I read Facebook posts every single day that are unlucky pole, rider error, etc., etc. But the reality is, you know, things go wrong when you're riding, and things aren't necessarily perfect. And for example, if you're show jumping, the difference between the perfect round and the imperfect round, it is not a lot between it necessarily. It's just tapping a pole. But what you can look at is, did you have control of the canter? Was the horse adequately warmed up? Did you have to stand around for too long before your, you know, before your competition? It's not necessarily looking at the pole, because that's the end result. It's looking at all the things before that that led up to the pole, you know, and I think it's being honest about that, not looking at that one thing, focusing on everything around it, what leads to that point in time. And don't be overcritical. You know, it's very easy. I see a lot of professional riders that are very, very hard on themselves, not on the horses actually, interestingly, but very, very hard on themselves. And I think, you know, we are just human. And sometimes you're riding 600 kilos of horse around a ring with flags and banners and all sorts going on, and it's not going to be perfect all the time, but just, you know, try to learn from it. It's a learning opportunity to try and hopefully avoid repeating mistakes. And I think actually using a trainer or a good friend or your support crew around you to kind of go through things, think about what went well, what were you pleased with, what could be improved, and try and use those things to make a difference going forward. Going back to the basics. So this is probably the most beneficial thing that can ever happen to a horse, in a weird way, is having an injury or needing some time off, because actually many horses come back better than ever. And actually, if you think about our eventers, our hunters, you know, they naturally have time off every single year, and then they come back in and they start with slow, controlled work, and then they move up from there. And this does reduce injury rate significantly. Employing slow, controlled work, starting from scratch, you know, working on straightness, strength and skills before you start doing the other stuff can be really beneficial. So rehab from injury is not always a bad thing, providing your rehab is appropriate and that you take it seriously and have good advice. And sort of lastly, but not leastly, is transport. So these are sort of things that often get overlooked and I think are really important, and they kind of tie back to lots of things we've talked about. But, you know, traveling a horse actually can be, is quite hard work for the horse. So they've walked as far as you have traveled them. So if you have to travel them 3 hours, it's equivalent of them walking that far. And if you drive badly and have a poorly maintained vehicle, it's probably like them doing an awful lot more than that. If they've got orthopedic issues, then obviously that could be stressing and straining those things. SI problems, back problems, you know, they can often be exacerbated by travel because they have to do lots and lots of micro movements to stabilize themselves during the journey. Make sure the vehicle's roadworthy. It's precious cargo. We love these animals, so drive accordingly. I often say to someone, imagine your baby's in the back with no seatbelt on, you know, think about driving like that. If you're late, that's not the horse's fault. So don't take it out on the horse by driving like a crazy person around the corners. Think about respiratory health, letting the head down, making sure that, you know, look at this trailer and there's lots of bedding and bits and bobs in there, which is fine for the horse, you know, absorbing wee and bits and pieces, but really not very good from a respiratory point of view. So thinking about making sure your trailer's clean, your horse box is clean, windows are open, etc. And do you have emergency breakdown cover, and do you have an emergency plan? So that is really a whistle-stop tour. I have tried really hard to stay to time, but I honestly could have talked for a long time about most of these things. But I think, to summarize, the areas of potential improvement with our horses are endless, okay? You know, try making your own lists, and I'm sure you can come up with huge numbers of things that you could do to improve a horse. But these tiny improvements, they might not be notable on a daily basis, but they add up. And it's really easy to overestimate the sort of importance of making a big change to get a big impact. And actually, making small changes often has a more long-lasting impact going forwards. Be the best that you can be the best your horse can be, and focus on the end goal. Think about what you're trying to, you know, achieve, and celebrate your successes along the way, whether that's, you know, getting the horse to lose weight, you know, improving your anxiety or your nerves, getting a better performance, better dressage marks. All of these things are things that you should be celebrating. So that is me.
Great, that was amazing. Thank you. That was so inspiring. And I love what you said. It's not about these, you know, big grand gestures. It's small things, keep going, and they really add up. So lots of lovely feedback and lots of what's the word, praise and the gratefulness, what's the word I'm looking for your mental health section, because I so agree. Us riders are, and horsey people, are just so tough on ourselves, and I think we're sometimes making life more unpleasant than it needs to be. One question on that note was, how much do you feel the rider's mental health impacts on the mental health of the horse, which I think is a brilliant question. I don't know the answer, but maybe Kate, you can shed some light on that. I'd love to hear your thoughts.
No, I think it's a really fantastic question, and I think that I don't have a statistical answer for you, but I have what I would consider my own personal answer. And I think the reality is that I think it does impact your horse. I think the bond that you have with your horse is often very unique, you know, and if you are anxious, if you're there, so some of the physiological ways that anxiety show will be, you know, increased heart rate, increased breathing rate, you know, more tension through the rein, more hesitance, quicker reactions, etc. And all of those things your horse is going to be able to tell. They're prey animals ultimately, so you know, they know body language inside out. They know if another horse is worried, and if they think, you know, they know if another human is worried. You often see, if people are anxious around horses, the horses often react differently to them. They'll be a bit more flighty, a bit more nervous. So I do think it does impact on your horses, but I don't think you should be too hard on yourself. Like, I get anxious like anybody else. I had a life-changing accident about 5 or 6 years ago, and so for me, rearing in particular is a big trigger. And the reality is that sometimes horses do rear because that's one of their fear manifestations. And it's trying not to let that become completely overwhelming and govern everything else, and try to tackle it, be honest with yourself, and think, you know what, these things could happen any day, any place. I could fall down the stairs, any of these things could happen. Try to make them little voices and not big voices if you can. But yes, I do think it impacts on horses. That's where things like developing rituals and strategies with regards to warm-ups, cool downs, etc. They all help you, because by doing something repetitively, that's what cognitive behavioral therapy is. It's all about doing something over and over again so that it makes you more comfortable. So if that's singing a song to yourself, if that's making sure that you walk for 3 minutes on one rein, 3 minutes on another rein, you always tack up from one place, one side, whatever it takes to help you manage your anxiety, it's definitely got to be beneficial. And it will help the horse as well, because they know what's coming, and they like to know what's coming next. Nobody likes to be surprised. So in that sense, so I think, try not to be too hard on yourself, but yes, I do think it can impact on the horse, which is why I think it's worth tackling.
Yeah, so agree, Kate. So important, and just so many takeaways. I've written so much down. Like, you're the queen of the soundbite, Kate. I particularly love like what came before the poll, because as you said, it's not really about the poll. There's like all these other things, and people's driving. You're so right. Where we live in Wiltshire, it's event essential. There's horses everywhere, which is obviously lovely, but you do see some shocking driving from time to time. And you're right, if you're late, it's not the horse's fault. And how can you expect the horse to do its best if we aren't giving it the best help and support? So much to take away from that, Kate. That was an amazing talk. Really loved that. Thank you. Brilliant. Well, Kate, we will wave goodbye to you. That was absolutely brilliant. Thank you so much. And what Kate was saying about cross-training is going to lead us very nicely into our next session, which is with